Hello, everyone. Thank you so much for coming out to the acupuncture and osteopathy and chronic pain. We're going to go ahead and get started. And I'm going to introduce our guest speaker, Dr. Stevan Walkowski. Dr. Stevan Walkowski is the Associate Dean of Clinical Sciences at the Alabama College of Osteopathic Medicine since October of 2021. Prior to that, he was the chair of the Department of Manipulative Medicine at Ohio University Heritage College of Osteopathic Medicine. Dr. Walkowski is a 1989 graduate of HCOM, where he was a fellow in preventative medicine and public health, and did his traditional rotating osteopathic internship at Doctors Hospital in Columbus, Ohio. He worked as a general practitioner until 1994, when he began a practice of inpatient and outpatient OMM and medical acupuncture. He became board certified in OMM and medical acupuncture and joined teaching faculty at Helms Medical Institute in 2002, and also the OMM faculty at HCOM in 2007. He helped open the new Dublin campus of HCOM in 2014 and became a chair of the department in 2016. His research interests are varied, but focus on the practice of education of OMM, the science of medical acupuncture, and lately the importance of humanity in medical education and practice. With that, I will give the mic to Dr. Stevan Walkowski.
Hey, everybody, good evening. Thanks for coming in tonight. Thanks for tuning in. I appreciate your interest. This is really exciting for me. I've had a practice of manipulative medicine and acupuncture since, as you heard, since '94. These past couple of years that I've been working in the administration at the Alabama College of Osteopathic Medicine, I haven't had a clinical practice, and I haven't done a lot of teaching. I've done a little bit of teaching, but this is really fun, and I'm really excited to be here tonight. Because acupuncture is really exciting, and I hope I communicate that to you and answer your questions as they come up to give you more understanding about what acupuncture is, maybe what it isn't, and just clear up any issues that you have. So this is a presentation that I call Acupuncture Osteopathy. This sort of goes after a book that was written by Mark Seam, who is a licensed acupuncturist, but called Acupuncture Osteopathy. And this is some years ago that he wrote this because he was fascinated with osteopathy, and he saw the parallels between acupuncture and osteopathy. And I hope he can bring those to light this evening. So moving on, let's see what I need to do to get that to go. So one of the, I've looked at a couple of your questions that some of you have presented in a Qualtrics survey prior to, and I'll answer those as I get reminded of them. But I also wanted, these are sort of like the questions that are the most common questions. And I just want to start off with those, and then we'll go from there. So how does it work? So that's what we'll talk about a little bit tonight. So I'm not going to answer that question right now. There's a number of levels that it works at, and I will touch on those and describe them a little bit. There's a tremendous amount of research that's out there from a basic science standpoint, both American and European and Chinese literature that really looks at the neurology of this and what is probably happening with acupuncture. There's a lot of research that doesn't take that into account, but is more a little more esoteric, but nevertheless fascinating in terms of what it portends and what it portrays. So is acupuncture paid for by insurance? Is a great question. As physicians, and you're not, some of you are there, but for the most part, as medical students and residents, you're not as concerned about whether insurance pays for this. But once you get into practice, whether something is paid for by insurance, it becomes crucial, because that's going to determine in large part whether or not people seek what you do, or that you would be allowed to do or treat patients with acupuncture. The short answer to the insurance question is yes. I never used to be able to say that. I used to say it's almost always cash, but acupuncture has been approved by Medicare Most private insurances will cover it now. It was usually covered under workers' comp. For the most part, acupuncture is covered in insurance. Now, it's a double-edged sword, right? Because if insurance covers it, then they can determine and they can tell you what to charge for it, or what you're able to charge, or basically what you're able to be reimbursed for. So again, stuff that's like way off in the horizon for you predominantly, but important to think about. So the short answer is yes, sort of. Still, a lot of physicians will charge cash for it because the reimbursement is so questionable. Does it hurt? Everybody asks, does it hurt? And the answer is, it depends. So the reality of it is you're using a single solid thin needle for insertion into the skin, and usually into what it would be the acupuncture point, so which that lives 1 to 2 centimeters below the skin surface. And I'll explain how we find those based on some criteria. But there are ways to insert needles in places in the body where it's very painless. There are other places that are impossible to get in without causing some discomfort. You can imagine that a point on the lateral aspect or the ulnar aspect of the hand, just inferior to the head of the distal 5th metacarpal, is going to be tender. And that's the case, or that similar homologue, we call them, that homologous point in the foot. Those are sensitive areas, and they're a lot more sensitive than the back. So there's a high likelihood that even if I do the best job possible, people are going to feel it. And if they don't feel it going in, they're going to feel it when it hits a point, because those points are tender. So that's the point there, for the fun, is that there are 2 places where it can be uncomfortable. One is going through the skin, and one is it reaches the acupuncture point. It's supposed to be uncomfortable when it reaches the acupuncture point. That's part of the therapy. So in acupuncture language, we call it de qi, which means getting qi, which is that the qi is that invisible force in the body. We don't know what it is, but it's that sensation, and it's probably type 2 somatosensory fibers firing deep in the muscle. And that's part of the therapeutic action of acupuncture. And hopefully I'll get into that. And then how does it integrate with osteopathy? I'll talk about that. From a practical standpoint, I sometimes will treat patients in the same session with acupuncture and osteopathy. Some people I will treat with osteopathy for a series of visits. And when they get to a place where I don't feel like I'm getting anywhere, I might add acupuncture for a series of visits and then go back to osteopathy. And when I used to do that, I used to find that it was like entirely new terrain that I was working with. The body had changed, their problems had changed, their dysfunction had different qualities to it. So it was fantastic. And I'll talk a little bit about how things are similar. Little time check here. So just, where does acupuncture work? So one of the places is in the myofascial region. And that's one of the points that I really want to make tonight, is the importance of treating the myofascia with acupuncture from a trigger point perspective. You have demonstrated your interest from a physical medicine or rehab standpoint. And so, one of the things that you'll be doing is treating folks with pain problems along with other things, and being able to treat their trigger points in addition to other things from an osteopathic perspective, but being able to treat trigger points is essential. So if you don't have access to a textbook now, with myofascial trigger points, Travell's trigger points is the most popular beast, and is the work which everything is based on. the Travell 2 volumes is a fantastic resource. There are many editions of Travell's. There's flip charts. There are other books that are sort of sub-written from Travell, but that is the gold standard. And you can get so much mileage out of looking at the Travell book and working from the Travell book when it comes to pain problems. So the release with the myofascial layer is usually immediate when I'm going to a trigger point. It's probably neurally mediated. I mean, that's sort of how these things should be working. It seems much faster than that, but it probably is interrupting pain fibers and interneurons at the spinal level from that area. So here's a question. This was a question that came up before the start of the program, which was, what's the difference between dry needling and acupuncture? Dry needling is a process that was taught. It's a treatment that's taught to non-physicians, to non-acupuncturists, predominantly physical therapists. It's using an acupuncture needle to get into a trigger point and vigorously stimulate it to get it to release. My bias is that the way that trigger point needling or that dry needling is taught, my bias is that it's heavy-handed, and that I have spoken to a number of patients who come away from that saying that was really uncomfortable. I do trigger point deactivation. I call it trigger point deactivation. It's uncomfortable, but it is not gaspingly uncomfortable. And I've had, I feel like I get just as great a success, and I don't get that same sort of patient reaction. In addition, a physical therapist who learns dry needling learns that on a weekend, generally. And the learning acupuncture is a longer process. It's probably about 6 months of a combination of a home study and clinical study. And that's if you took the physician acupuncture course. If you take a non-physician acupuncture program, it's probably 2 years. You're probably in residence wherever that happens or wherever you take that course, and you're in class more frequently. And the reason is because these are classes that are open to folks that are don't have a medical degree. So the medical course for physicians is specific, taught by physicians, and it makes an assumption that you already understand some medicine. So there's all that. So this is a Travell illustration of the rhomboid region, and these are trigger points in the rhomboid. You have probably found something like trigger points. This is also this picture here are trigger points in the levator scap, and again, this is out of Travell, and the way this map is that these X's are usually commonly found locations where there are triggers. So a trigger is like a pea-sized nodule. It feels like it's in the muscle. You press on it, it irradiates pain. Very much like counterstrain points, but it's not exactly counterstrain points. Sort of like Chapman's points, but not exactly like Chapman's points. And then this red stippling is the radiation of that pain. So another hallmark of trigger points is that they radiate in a non-dermatomal distribution. So you can have triggers in the shoulder or in the suboccipital region that radiate up into the temporal region and are causative for headaches. So if you can work back and find out where those triggers are, you can do a tremendous amount of work. I can't even begin to tell you how many times I've worked with patients that have had pain, found triggers, people that were on their way to surgery, found triggers, and, that it changes. And so what we're taught in medicine is that, if certain things hurt in certain areas, it means certain things. And one of those certain things is usually not trigger points. And so it behooves you, if you can take away one thing from this tonight, think about triggers. If you have anybody that works with pain, gentlemen, if you have anybody who works with pain, think about your triggers and trigger points in terms of its relationship as a source of that pain. All right, so acupoints overlap with trigger points. So acupoints are specific to named points. So 300 and some odd named points on the body. They're along meridians, which are basically artificial lines that the Chinese physicians use to sort of connect the dots, to connect those points, and then created a medical mythology around that, kind of like we do, but different. So trigger points are about 70% overlap with acupoints. They overlap with counterstrain points, and so do triggers. And as I said, there's 350 points, but also ashi points, which ashi points are simply points that hurt. So, I may choose to insert a needle into kidney 3 or kidney 10 because that's where I think that I need to work. But also I'm going to work with the points that are ashi points, or that are yelling at me. Click this. So this is a great slide. So if you can see this, this is the illustration of the yin and yang meridians of the upper extremity, and you can kind of see that. Hopefully your computer will be able to pick up those colors. They're a little mellow, so they might not be as bold as you want them to be. But that's, those are points that are connected by meridian lines, and there's a reason. I won't say there's a reason for why they're called what they are, but they each have a certain quality and set of characteristics. This is a great study that was a electron microscopy of fascia as it is integrated with an acupuncture needle. So what you're seeing in that those images are this sense of almost cotton candy as the fascia kind of twists around the needle. So what's happening there is, okay, so there's a pretty picture, but think about what's happening on a macro level now with that. So you're disturbing basically the mechanics of the fascia, and you're inducing mechanotransduction. So if you know anything about the tensegrity system and the tensegrity network, what you're doing, or this is demonstrating the idea that acupuncture is probably working at a mechanical level with fascia. And that's certainly one of the big things and the big pieces of its relationship to osteopathy as well. This next slide is interesting in that these are serial cross sections, and what you see demonstrated there are around those cross sections are illustrated the acupuncture points. And the point here in the slide is that many of these points line up with fascial cleavage planes within the muscle. So, what you're looking at is a humerus, and there's and then the muscle around it to the outer fascia and the fat in the perimeter. And these points are at fascial cleavage planes that are connected deeply, basically, into the periosteum, and they work to separate the muscles. And we know that from working with anatomy cadavers, but this is sort of a different way of looking at it and conceptualizing it. So again, acupoints are named and are anatomically described, like the point exists in the at the insertion of the deltoid, and many acupoints have a relationship to muscle cleavage planes. They also are associated sometimes with large peripheral nerves, nerves emerging within the fascia from deep to superficial, cutaneous nerves as they come up, nerves in bony foramina. So bony foramina sometimes are named acupuncture points. And then they also coincidentally will be associated with motor points and neuromuscular. And we always, in the courses, will have a PM&R person or a neurologist who routinely does EMGs and will say, you know, that point is a motor point. That's exactly where I would put an EMG needle. Additionally, where blood vessels move through, where nerves will bifurcate or will come together, ligaments, suture lines, all of those are, you know, it's as if, and it's certainly, I mean, I think it's pretty undeniable that somebody palpated on the body and said, there's a point there. And we talk about them as holes. So we talk about them as you know, depressions in the fascia. And so they looked at those and said, this seems like a hole. This should be where we put a needle, or whatever they decided to do when they first decided to do acupuncture. And then they connected those and created meridian lines out of them. The next piece in terms of spinal cortical midbrain and neurohumeral, this is a way that the acupuncture points and acupuncture treatments work, or at least it's a model for how acupuncture works. And this is really a neurological model. And I'm going to go through these slides because they are pretty busy, but they're pretty cool. So this is just a very basic schematic about, you know, this is a painful stimulus. This is a spinal cord, this rectangle here. This is to be midbrain. This is a pituitary hypothalamus, is thalamus, and then cortex. And this is an acupuncture needle going into a muscle. So it connects with the spinal cord, midbrain, pituitary. And so the question is, you know, how does the acupuncture needle interface with the pain signal? And this specifically deals with electroacupuncture, where electroacupuncture is using acupuncture and then connecting it to a little transistor 9-volt battery on a rheostat, and it changes the frequency variably. So you can change it to a low frequency stimulation, 2 to 4 hertz, or you can change it to a high frequency stimulation, 15, 30, 100. And there are all kinds of sophisticated ways to do this. I have boxes here that are very simple in terms of delivering their signal. So in this, these black lines are to show propagation of the signal, and then these triangles are, suggesting synapses that will potentially, if this is presynaptic, this will potentially interrupt the pain signal. So this is based on a volume of research, and this is old research. This is research from the 90s that has been collated. So there are ways. This is directly inhibiting a first order neuron pain into the spinal cord. This is directing a signal into the midbrain, and then the dorsal lateral tract down, again, inhibiting at the level of spinal cord. And then this is also delivering a signal to the pituitary hypothalamus, and there is the release of endorphin centrally. So the discovery of endorphin, I know this probably is ancient medical history to you, but the discovery of endorphin was huge. And one of the, this happened sort of simultaneously where people said, oh, maybe this is why acupuncture works. And so they developed a number of lines of evidence to say that endorphin was indeed part of the program. And this is just a different, with high frequency, it has less endorphinergic from the pituitary hypothalamus. But high frequency stimulation is has more short-term analgesia. Low frequency stimulation has a longer term analgesia. There's more of a sense of, in a high frequency stimulation, the sense is that there is it's almost immediate in terms of the relief. Is there what kind of question do you have, Austin?
So I have one here.
Excellent.
Also 6:30.
Okay, thank you.
You can, I can read it to you if you
Please read it to me rather than I have to put
How do you differentiate those points from Chapman points versus counterstrain points? Which would you try and treat first?
Oh, great. So Chapman's points are my bias is that Chapman's points are extremely difficult to palpate. So I'm just going to ignore that part because I don't treat them. But the difference, a big difference between counterstrain points and trigger points are that a trigger point by definition will radiate pain. So in a trigger point should remain local. So when you press on a trigger point, you shouldn't have people say, oh yeah, doc, that hurts in my right hip. Whereas that will sometimes may happen with treating an acupuncture point or a trigger point. So it's not uncommon for me to look at, let's say, pain in the iliolumbar region, iliolumbar ligament region that radiates into the buttocks and gluteal region, and I'll treat that there. That's mostly answer it. Okay. Say again.
Whenever you want to do the demonstration.
Yeah, no, that's great. Yeah, so I'm at 31. Okay, let me see what else I have here. If there's anything good that I just can't bear to not talk about. This is just talking about the endorphin evidence, so just a quick commercial for the similarity between osteopathy and acupuncture, and how you, as a nascent physician, can really benefit from this kind of education. And that's acupuncture is very is about supporting the normal homeostasis. So one of the principles of osteopathy is that that health is the primacy of health, and that if we release the obstructions, the normal process of the body of homeostasis will occur. And so, we in Western medicine, we have a lot of things to suppress things. So we have anti-inflammatories and analgesics. And this really, acupuncture and osteopathy both are all about reinforcing the normal processes in the body. So there's very much a similarity there. We talk about, in acupuncture, we talk about treating distally. So there might be problems that we treat, in the foot or the hand, to activate issues somewhere else entirely. And similarly, when you're treating osteopathy myofascially, you might be working somewhere else from where the site of the pain is. All right, I'm going to stop, I think, pretty soon. And I will move on from there. This is just, this is a quick commercial for ACUS Foundation, which is the branch of the training program that we help treat military physicians. So that's still ongoing. And we demonstrated changes in opiate usage and other medication usage, and kept people, there was more service member time was increased. So there's that. All right. Okay. Enough about that. Yes, let's do a demo. And I have a few folks here, and shout out your questions when you have them. Okay. So come over here, Austin. I just want to show really quickly what I've got, sort of my gear. So this is electroacupuncture unit I was saying, and you can come up and look if you want. Like I said, this is just a 9-volt battery on a rheostat, and you can set the frequency, and I can use these alligator clips to connect to acupuncture. This is ear acupuncture. if you could just get a quick shot of this. So the idea of auricular acupuncture, ear acupuncture, is that, there you go, is that the human body has a map on the ear, on the surface of the ear. And so treating that has an impact, particularly in pain. It is the most bizarre thing in the world because it works. And it works. I've seen it do really incredible things. For those of you that are familiar or that have a military experience, you may have heard sometime of battlefield acupuncture, and that's what this came out of. So that was started by a guy named Richard Niemsau from the Air Force, and that has gone viral through the military. These are typical needles. So these are 40 millimeter needles that I use. Largely, these are sort of the workhorse of what I do from an acupuncture perspective. These are larger. These are 100 millimeter needles. So these could be used for gluteal triggers or just big people. But sometimes I need a longer needle to get. I'll get through the interosseous membrane between the tib and the fib. Sometimes there's a particular treatment for that, and I will use this type of needle or longer. These are, you can barely see this, mostly plunger, like 99% of this is a plunger. There's a little gold stud here that is used for ear points. And so I might use these and the only thing that'll be left in the ear is this little gold stud. And it just goes into the surface of the ear in the skin and falls out on its own. These are seeds. This is another way to treat the ear. So these, I just put these on, and they have an impact. They're a little bit irritating, almost in the background, but they stimulate the acupoint. All right, about that. So, who wants to go first? So what I'll start with is somebody. Look at that. All right. Yeah. So what do you want to work on?
So I have tightness in my back.
Okay.
Which I think was the trigger point you actually showed.
Okay.
I also have anxiety.
Yep.
Which would be cool to treat.
Great. Okay.
I also have a cyst in my ear.
What's that?
I have a cyst in my ear. And
Okay.
I was wondering if there's anything that we could do to get
Great. Okay. Well, let's do this. Go ahead and take off your shoes, socks, if you would, and you can take off your ID. I will not tell Dr. May. These are nice little needles for ear. So what I'm going to do is, let's work with your shoulder point first, and I'm going to move you over here. If you will go ahead and turn around. Is it okay to put hands
Yeah,
in here?
of course.
And where's the shoulder thing?
So on the right.
Yeah. So in the rhomboid region. Okay, so there's that. Is that it? Yeah, right there.
Yeah,
So there's a knot there. So is there any way, or would you be uncomfortable, and please be honest with me, to take off your scarf top?
Yeah.
That's great. We're all osteopaths around here.
Yeah. Right.
That's great. Perfect. And you can see the red mark from me mashing on it. And that's really how you find triggers, is they're just lumpy places in the myofascial region, and they tend to recreate the pain. So, when I get on a trigger point, I'll say, is that it? And people say, yeah, it's just like it when it bugs me. All right. So there's that. So given that, well, before I do anything with that, I'm going to treat that from treating your ear first. Is that okay?
Yeah.
So go ahead and turn so that I'm seeing this ear. So usually if it's a problem on the right side, I'll be treating the ipsilateral ear. And this is it's a point finder. So it's basically just an ohm meter. and I will, by making a connection with him, I'm creating a circuit between the two of us, and my thumb is on this thumb pad. And so where there is decreased resistance, the little light will light and the buzzer will buzz. So what I'm going to do is look for this shoulder region, and scan for it and see if there's anything that's active, right? So before I do that, go ahead and move your shoulder a little bit and just tell me what that feels like. And if it's 100% good, then we'll make something
I
up.
feel it in that point.
Okay, when you do that, you can feel it. All right, great. So when you saw this is the head region, this is cervical region, this is thoracic region, lumbar, and sacral. So I'm going to look a little more. This is the shoulder area, the top of the shoulder, and then the upper extremity is in the scaphoid fossa of the ear. So I'm going to just look in here, which is just sort of posterior to the spine. It looks like it probably at about C2 or C2. So these are just little ear needles. Yep, so that's an ear needle. You can kind of see that. They're like little 15 millimeter needles. This is, but feel okay?
Yeah.
All right. So that's that. All right. That count of 2. And then see if that, go ahead and move your shoulder around and see if that changed at all.
Yeah, it feels a little smoother. I still feel it though.
Okay. So where do you feel it now? Point to it. Okay, great. So lower your shoulder blade. So, and that's lower than where I was. I was a little higher and more medial, but that's okay.
That's what I feel here.
Good. All right. So let's go here and go a little bit. I'm going to go a little bit further down in the thoracic spine and look for. Let me get a little closer. So I'm not getting anything, and that's okay. What I will do then I'm going to turn you slightly so that you can be seen here. There are a series of other points called master points that are not specifically related to the musculoskeletal anatomy, but mostly the neurological anatomy, and some are just functional points. This is a point around for the thalamus. And so I like to use this sometimes for pain just to reinforce. You doing okay? Yeah. So, and I wouldn't ever treat somebody standing. Just saying. That, okay, go ahead and move your shoulder again.
Yeah, I don't feel.
Can you say it one more time?
Yeah, I don't feel anything.
My shoulder. Have we met before?
No.
Great. Okay. Good. So go ahead and lay down on your back. And then we'll do just a general treatment for the anxiety. We'll sort of put these points in and then sort of let you cook. Is there something? Can you get a pillow, a couple pillows for me from the pillow supply store? So what this does, this is just a general, we call it a general sedating treatment. It's not going to be like sedating, like somebody gives you a general anesthesia, and then I have you lift the primary nose. So I'm just, and I'm going to start here with 2 points as you call 4 gates, which is LA4 and number 3. These are just big points in the body. That's acupuncture. Is that okay?
Mm-hmm.
So tell me when that feels like aching. Did you get it?
I can feel it.
Okay, let's just leave it at that. To not abuse you too much.
Is it better to show your hand, or it doesn't matter?
If you feel it, that's on. There we go. So that, yeah. So, and you'll get different sensations. Like that. You'll get the sensation of like, and or it'll just be like, yeah, I feel that. These are will sometimes feel good. Let me know when you get this.
Yeah.
Okay.
Yep.
Great. And then the last one, you do okay?
Yeah.
All right. Great. And this is, I'm just gonna put this as the 4.5, which is just, I mean, it's really the third eye. Okay.
Mhm.
Good. All right, that's you. Yeah. It's you for 5 or 10 minutes.
How do you do? Why do you do it? Put a point in the third eye?
It is the points along the midline are generally relaxing, and so this helps to focus and helps to just bring everybody down and show them just a little bit. Since you hanging out. It was something else you said, maybe just sort of a energy boost and just sort of revitalization, feeling a little drained.
Right, that I do.
Oh, good. I mean, that's good. Good. Yeah.
Right. Just to give you like a slight history.
Okay.
Back in the day, it was great. So it's quite a long time. Football, I got high levels. So when I came here, average just kind of stayed. Somebody else came here.
Oh.
And it kind of hyperextended my whole body. Got that checked out. It was in Japan, so it's a little different here. Didn't get it fully examined, but I got an X-ray. The disc between L5 and S1 is a little bit narrow. That's pretty much all they found. So at that point, I just kind of started working out around this area just to strengthen and reinforce that. So basically now it's fine, but I can't sit for very long. Like after 1 hour, I have to get up and kind of like.
Right.
But that's pretty much it. So I have a lot of like hypertonicity in that paraventricle area just from like working with that specifically, just to hold it in place. Outside of that,
How did you do when you were hit? I mean, did you walk off the field or?
for a second, I did hear a crack, so I feel like something.
Okay.
No, I just kept playing. Like,
Oh, okay.
I shouldn't have.
Right.
And I on top of that, the next weightlifting, like it's a sport, so I had like a lot of overhead movements where I just a lot of load going right down, right back.
Great. Okay, let's do something. If you would just take off your shoes, you don't have to take off your socks. I'm not going to need your feet. I'm just going to focus on low back. This is
infection a
Sorry?
concern? One of the questions they have is infection a concern?
Great. These are sterile needles. My hands are clean. I used hand cleaner before we got here. And so, yeah, the opportunity for infection is like infinitesimally low. And additionally, in many cases, I will use electrical stim, and the electrical stimulation of the needles is a natural, it's a bacteria killer. So yeah, it's not an issue.
And then what are some of the ways to handle hesitancy that some patients, especially the elderly populations, have towards acupuncture?
Great. It's a great question. At its worst, I won't touch it. It's, I will work with them and say, what do you think? What can we do? And I have strategies to sort of get people into it. But if somebody is like fearful beyond that sort of negotiation process, I'll just bail out and say, okay, this is, let's not do this. This is not okay. I'm going to do some manipulation with you and think about this. And here's what it feels like in the top of your head if they'll let me do it, and take it out and say, okay, that's all we're going to do today. Just think about it. And if you want to do it, let me know. But it is usually is a point of just approaching them gradually and saying, do you want to keep trying this?
And then considering the immediate effect of the treatment, can acupuncture be done during a typical office visit, like in family medicine, while handling other concerns the patient has, like medication refills, lab follow-up, et cetera?
Great question. I think so, but probably not in a 10-minute office visit. Usually what I've seen most family docs manage, they'll bring them back. So they'll deal with the singular or the intermediate office visit now for whatever medical problem they have, and then bring back their patients for, like, they have an acupuncture clinic. And what I found in my life is that I need that space in my head to be able to think only in an acupuncture way and not in a traditional medicine and acupuncture oral MT way. Good.
And then Gerald, did you have a question? Okay.
Okay. Go ahead and lay face down. You don't. I'm gonna bring your scrub top off if that's okay.
While you're doing that, someone else asked, can this be done to modulate pain during an acute MSK injury, for example, during on court side during a sporting event or backstage of a dance competition?
Oh yeah, that is the most incredible thing. Whether you're treating somebody from you can treat their ear, excellent. You can treat. There's an acupuncture type of treatment called tendinomuscular meridian, which is perfect for acute injuries. So a sprained ankle. I mean, I've seen sprained ankles that look huge. I mean, just go down significantly, in 15 minutes. And people that are not able to walk on an ankle can afterwards. So it's just, it is outrageous and amazing. All right, I'm gonna bring you through here. So I am going to look for L4, march up to L3 and L2, and I'm going to use one point here at the interspace of L2, here at the first fascial line in the paravertebral muscles, an outer point, the outer bladder line point, which is sort of at the external aspect of the iliocostalis, and then another point at the tip of the 12th rib, which is called 12th letter 5. Right back. All right. All right. This is 4 and 3 and 2 here. So this is acupuncture. Good. Good. Is that okay? Yep. All right. You doing okay? Yeah. All right. So I'm going to get these in and sort of let them rest. This is, your right side is tighter than your left, or maybe you're already letting it go. So doing okay still? Yep. Okay.
One of the questions was, you mentioned the ACUS Foundation. Can you speak to any experiences you've had treating veterans, active duty members with TBIs?
Oh, yeah.
TBI management.
Right. So there's a whole process, a whole protocol that we use for TBI that really helps people to come around not only with their head issues, but also with the mental emotional piece that goes along with that. That was why I was interested about your trauma, because there's a lot that I love to do with folks with trauma history and the trauma response, the trauma spectrum response. Doing okay? Yep. I'm going to connect this with a little electrical stim. Are you okay with that? Yeah. It's yeah, very mild.
And then we got about 5 minutes.
Yeah. I'm gonna.
Dr. Walkowski, I have a question for you, if that's okay.
Yes.
So as you are doing the electrical stim, in physical therapy, especially, patients will often use a 10th unit for similar reasons. I was wondering if you could explain, I guess, the similarities or differences between how you are doing your acupuncture treatment right now versus how a patient may use a 10th unit, for something like low back pain.
I will. And I'm going to get this set up, and then I'll pontificate. So you're going to feel this on this side, and it's going to feel like a tap about like this at the points. And I want you to let me know when you first start to feel it. This is on the right. Yeah. Good. So what I'm doing is I'm just turning up the amplitude just a little bit. So you can see that shaking. So that's like just pinging the muscles a little bit. This is going to be on the left-hand side. Oh, okay. Yeah. Is that okay?
Yeah, no, they're about the same.
Yeah. Is it too strong?
No.
Okay, great. So I'm going to let you coast there for probably about 10 minutes. We'll probably be off the Zoom call before that, but I'm going to let you rest here. Okay. So you do your thing.
Just the question.
So yeah, the question. So the difference between electrical stim here and electrical stim at physical therapy is really how it's applied. So in physical therapy, what they use are TENS units, and the TENS, it uses surface electrodes. And what the surface electrode has to do is it has to penetrate the electrical signal through the skin and down, maybe to the level of muscle, maybe to the level of the nerve. But usually they have to use a pretty high amplitude, and meaning they have to turn the signal up pretty high. And they usually use it in high frequency modes, generally. I mean, they may fluctuate, but predominantly it's high frequency. What you saw me do here was different in that I use a low frequency. I would venture a guess that a physical therapist would probably never use 4 hertz. And the big difference is because I'm using a needle, I'm already going through the skin surface. So I am breaking the resistance of the skin. So I don't have to use as high an amplitude in order to get the signal into the system. Now, take this one step further. The treatment that I'm doing here is basically an electroacupuncture energetic treatment utilizing the principles of Chinese medicine. And that was one of my first questions that I wanted to answer. There's another style of treatment utilizing this electroacupuncture that's a lot more focused on the spinal nerves. So I want to get my needle down to as close to the peripheral nerve roots as I can, and turn the volume up just enough so that people feel it, but it's to get some stimulus to that nerve root. And I'm going to take this moment, and it's 7 o'clock, and I'm going to take the needles out.
Does anyone have any other questions for the next 5 minutes before we wrap up the talk? Please put it in the chat or unmute yourself.
This one likes to bleed, but it's not, so it's good. Good. You're good. You're needle free, as they say.
And I'm supposed to not.
Would the stimulation to spinal nerves be used to potentially treat phantom limb pain?
Yes, it's difficult, but yes. So you can, when you're treating phantom limb pain, you can treat centrally. So you can treat at the level of spinal cord. You can treat the opposite limb to get into the thalamic reflection of the extremity. There are ways to treat the scar, the amputation scar, with injection of lidocaine, and the ear treatments are very helpful. And this is a point that you want to think about, is that treatment of the trauma syndrome is extremely important when it comes to things like that, because in many ways, sometimes it is the trauma syndrome that's helping to perpetuate that. I mean, it's lowering the threshold for experiencing of that pain. And so treating that is extremely important. And that's another topic, but that's a really important and a piece of acupuncture that I really enjoy doing.
Thank you guys all so much for coming. I think we're going to wrap it up at this point. It's after 7. So thank you guys again. And if you have questions, I will be sending out the PowerPoint for this talk to your email address. So stay tuned for that. And I hope you have a great rest of your day.